It's great to have you join us on another episode of Wellbeing here on AG4 TV Radio. I am Antonietta Kalunta. The COVID-19 pandemic came with its ripple effects of economic recession and various ways in which it affected people's mental health, creating new barriers for people already suffering from mental health challenges and substance use disorders. Joining us from Lagos, Nigeria, to examine the implications of COVID-19 on the mental health of many people is Dr. Bonjubola Babalola Abiri, a consultant psychiatrist and medical doctor. It's great to have you join us today, ma'am. Okay, so can I call you Abiri?
It's fine.
Okay.
Yeah.
All right, so I'd like to start from the basics for us to understand what a mental health illness is or what a mental health challenge is. So firstly, I'd like you to differentiate. Is there any difference between a mental health challenge and a mental health illness?
The World Health Organization would describe health as not just the absence of disease or infirmity, but a complete state of physical, mental, and social well-being. And so the absence of illness may not accurately say that the individual is healthy, especially because it's a complete state of physical, mental, and social well-being. However, if you then went on to what mental health is, mental health refers to, when we say mental, being able to successfully perform the functions that are expected of it. So functions of thought, functions of cognition, functions of emotions, functions of belief, perception, and behavior. And so when an individual's brain is successfully able to perform the functions in all these areas in such a way that the individual is able to engage in productive activities, contribute their own quota to the environment, cope with the normal stresses of life, say that this individual is mentally healthy. Mental illness, on the other hand, is an illness that affects those areas that I initially mentioned, an illness that can affect emotions, thoughts, cognition, beliefs, perception, and behavior. And mental illnesses are associated with a destructive pattern, a distressing destructive pattern that would cause pain, suffering, disability, disease, and also death to the individual.
Okay, ma'am. So based on your work at Berry, can you tell us what has been the most significant impact of COVID-19 on mental health?
Well, thank you for that question. And to be honest, I would say to you that I may not be able to give you one precise answer. But then if you ask me that as COVID-19 impacted on mental health, I would tell you definitely yes. It was unexpected. No one was expecting it. And then, while we're all wishing each other Happy New Year, a lot of people were looking forward to a lot of hopes, goals, aspirations, dreams, and desires that they had. We didn't know that the virus was already cooking in Wuhan, China on the 31st of December, 2019. And by February 27, 2020, when Nigeria got its first case, it was a flurry of emotions, You remember when people were saying, oh, it's not a black man's disease. The sun will help us kill off the virus. It won't even come near us. And then so people went from doubt, they went from doubt to disbelief, to shock as it started coming onto the shores, to confusion, to increased tension, to increased irritability. And then when the cases then started rising, the reality is the borders were shut. A lockdown was enforced. It also depends on, what socioeconomic status they were. And I remember when the pandemic started and I drove into a fuel station and the fuel attendant was saying, I didn't believe this thing until people started dying. Somebody in a low socioeconomic status whose, access to funds was really little must have felt extremely overwhelmed at the time. Of course, you also don't want to forget the people who worked on the front lines. So there were people who worked directly with these individuals, who saw them, who watched them die, people who had the virus, and other people who were essential services, who despite the fact that there was a lockdown, continued to work. So the mental health implications are varied for different people, depending on what part of their lives we're looking at. But I must tell you that it had effect on everyone. We may not all respond in the same way. And we also had people who went from normal responses to abnormal responses and then to distress. So for instance, you would have people who were tense, confused, feeling irritable. You had people who then started having problems with their mood, people who lost interest, people who started feeling helpless and hopeless, people who may have had issues with sleep, appetite, sexual problems, or people who then broke down with major mental health problems. So it's a spectrum. And of course, like I said, it depends on who was affected, when they were affected, and how they were affected. But definitely, people's mental health came under intense pressure.
All right, Dr. Abiri, you mentioned that it's on a spectrum. So for many people, the question will be, when should I see a specialist? So at what point does a specialist come in?
Quite a number of times, and because of the environment that we live in, largely because of the perception of mental health, perception of mental illness, and the interpretation of all of this. People often think that, you should wait until somebody is acutely or chronically psychotic, closed off, living on the streets before they see a specialist. But that's not always it. So sometimes, even when significant life events happen, life events like loss, loss of a loved one, life events like a change in job, life events like a change in relationship. So for instance, a divorce, things that would normally happen to individuals, but of course would impact on their mental health. So again, their emotions, their cognition, and all of that. And then, of course, when people have mental health conditions that start to affect their functioning in terms of their personal functioning, their occupational functioning, their relationships with others, and their functioning in the environment. If you remember when I described what mental health was, I said that when an individual is mentally healthy, they must be able to meet 4 certain criteria. Those criteria are pretty much about themselves as individuals, themselves as working in a working community, themselves in an environment, and their relationships with other people. So of course, when individuals start to have conditions that affect any of their functioning, and that functioning can be problems with sleep, problems with eating, problems with their mood, problems with their emotions, problems regulating their emotions, or when they find that they're beginning to cope maladaptively. And maladaptive coping would include things like becoming extremely aggressive when it's not necessary to be, using substances such as increasing use of alcohol, increasing illicit substances. When individuals start to cut themselves in a bid to cope with the normal stresses of life, they will then need to see a specialist. But it's not until, the individual is all unkempt, not good looking, does not have a house, lives under a bridge before they see a therapist. Even in, the normal things that happen to us as individuals, going through significant change and you don't know how to cope, you can actually see a specialist.
If you're just joining us, this is Wellbeing, and today we are being joined from Lagos, Nigeria by Dr. Bonjubola Babalola Abiri, who is a consultant psychiatrist and medical doctor, and she's helping us examine the implications of COVID-19 on the mental health of people. We'll take a break now. When we return, more details. You're welcome back from that quick break. This is Wellbeing, and today we are examining the implications of COVID-19 on the mental health of Nigerians, and we're being joined by Dr. Bonjubola Babalola Abiri, who is helping us examine the implications of this pandemic on the mental health of people. Thank you so much for being with us today, ma'am. So now, in seeing a specialist, where does one find a specialist? In the general hospital, where do I find a psychiatrist or counselor that can help?
Since we're in Lagos, talk about Lagos. And I know that in Lagos, there are private psychiatric facilities and public psychiatric facilities. So public psychiatric facilities, so for instance, Lagos has flagship centers, they call them flagship centers, which are primary healthcare centers, where you have, the medical officers who are trained to take care of mental health conditions. You also have certain specialist hospitals. So for instance, you have the Yaba Psychiatric Hospital, you have Luth that has a psychiatric department, dedicated psychiatric department. You have Lasus that has a dedicated psychiatric department. And then of course, you have a number of private psychiatric hospitals. They may not be so popular, but of course, these days people are able to find us via, the internet. So for instance, I work in a private psychiatric facility, It's called Tranquil and Quest Behavioral Health. That's just one of the many that we have in Lagos at present.
Okay, so who is more prone to mental health challenges? You referred to someone who is trying to, abuse substances, someone who has lost someone, but generally, who is more prone to these challenges?
So if I were to answer that question, I would tell you anyone and everyone. And then, of course, anyone and everyone, if the mix is right. It's what I often say to my clients, and I say to them that the truth is, I could be on your side of the table, the conditions just to be right. But of course, are there risk factors that tilt one towards having a mental health condition as compared with another? Definitely yes. And so some of this would be age, depending on the age. Some mental health conditions are commoner in childhood, in adolescence, or in adulthood. So for instance, if you're looking at old age, you can have dementia. If you're looking at adult years, you can have mood disorders, you can have schizophrenia. If you're looking at children, you can have conduct problems. If you're looking at adolescents, you can have personality issues, especially when they turn 18. So that's for age. If you're looking at gender, females are more likely than males to suffer from depression. They're more likely than males to suffer from an anxiety problem. Males are more likely to use alcohol. You understand? So it depends on the condition. Then, of course, in families where there's already a positive mental health history, meaning someone in that family already has a mental health condition, chances that someone else in that family can come down with a mental health condition is also quite high. And of course, we have things like, people who live in areas of social disadvantage, where there's poverty, there's ignorance, there's a lot of disease, there's, there are problems with jobs, there are problems, it's a low socioeconomic status. Those areas too are prone to certain, health conditions such as substance abuse. But of course, it also doesn't mean that people who live in high socioeconomic areas cannot also suffer from health conditions. So it depends on what socio-demographic factor that we're looking at. But the truth is, anyone and everyone, as long as the conditions are right, exposure to trauma, not having supportive family members around them, or not even being financially buoyant, can be factors that can tilt one to have a mental health condition or disorder.
Okay, Dr. Abiri, so how does one, in the midst of all of this, we're in the middle of a pandemic, which seems like this is the reality we're going to live with for a while. Some people have lost their jobs, some people have lost loved ones within this period. How does one cope with all of this? What are the things one needs to do in order to ensure your mental health is not affected?
So when we talk about coping, we look at two types of coping. There's the emotion-reducing coping, and then there's the problem-solving coping. The emotion-reducing will, of course, look at reducing the type of emotions, especially the negative emotions that you give to situations when they arise. The problem-solving will look at you trying to solve the problem when the problem arises. And the truth is, I think the first thing that we need to do is what we call a radical acceptance. The pandemic is here. Our world as we knew it has changed. And the earlier we all come to that realization, the better for all of us. This is no longer the new normal. This is the now normal. This is it. And somehow we have to face it. The other thing that we also need to learn, like I'm sure a couple of people have been learning over time, is that more than ever before, we need relationships. We need others to survive. We need others for strength. We need others for love. And we need others to help us sail through this difficult time. The other thing that I would say, of course, is that we need to focus on the things that we can control. There's so many things going on around right now. We may not be able to control everything, but we need to focus on the things that we can control. It's important to also, be able to look for ways to relax. Look for healthy ways to relax. And so instead of coping maladaptively by using alcohol, substances of abuse, being aggressive, it's important to learn how to use adaptive measures. And remember, I had spoken about emotion reducing and problem solving. And of course, that would focus on identifying what the problem is. So yes, there's a pandemic, but the truth is life has not stopped because there's a pandemic. A lot of other things have continued to go on. People have lost jobs, like you rightly said. People have lost loved ones. People have lost relationships, not because they're gone, but because they can't, cope or stand each other anymore. People have gone through trauma in this time. And for that reason, people need to understand what it is that they're going through. You need to be able to, think up and practice more of, healthy emotions and healthy responses whenever you think about the reality that is ongoing. Part of, emotion reducing and problem solving also speaks to the fact that we need to vent when there's a problem, talk about it, find someone you can talk to, read up more about whatever it is that is going on per time. But most importantly, if you do feel overwhelmed at any point in time, by all means, please see a professional. For me to add one more, so that I don't take too much of our time, I would say to us that we need to remember to be kind to ourselves. We can be kind to a lot of people, but if you're not kind to yourself, we often say that you cannot give what you don't have. Self-care is not selfish, and as such, at every point in time, take time to refuel yourself. Refuel, refoil, reignite, and then, of course, be ready to help others as well. You need to take care of yourself mentally. You need to take care of yourself physically.
I'd like to ask, is there a cure for mental health illness?
When we talk about mental illnesses, we don't talk about a cure. And that's because mental illnesses many times are chronic and disabling conditions. So what we talk about more is management of mental illnesses. Of course, if we can also talk about prevention. We talk about early intervention. Can they be prevented? Yes, some of them can. Can we do early intervention? And early intervention means by the time we start to see the signs that are suggestive of a mental health disorder, it's important to get help as soon as possible. But of course, for the management, it is manageable, depending again on the condition that we're looking at. And so, for instance, when we talk about management, we do what is called a holistic approach to management. And that holistic approach is such that it covers biological medications, psychological, which has to do with psychological interventions. So either a personality assessment, psychological therapies that the individual may need, depending on what condition we're managing, and then social intervention. And of course, that social intervention looks at social circumstances that are, disturbing in the individual, and sometimes also looks at occupational functioning as well. So to a large extent, mental health conditions or disorders can be managed, and mental illnesses are manageable, they're treatable. Like I said, we don't usually say that there's a cure, because very often if you tell people there's a cure, it may sound as if you're misleading them. But can they be managed? Yes, they can, and successfully too. And of course, individuals that have mental illnesses can live a normal, full, and productive life.
Thank you so much, Dr. Abiri. It's been really enlightening talking to you. It's been an enlightening chat with Dr. Bonjubola Babalola Abiri, a consultant psychiatrist and medical doctor from Lagos, Nigeria. Thank you for watching this episode of Wellbeing. I am Antonietta Kalunta. It may sound like the most cliche mantra you've heard recently, especially since the rise of this pandemic, but I need you to know, because it is true, that this too shall pass.